Okay, so now we are having another method, that is laser prostatectomy. Here, just removal of the prostate is being done, but the method is different, approach is different. So, from the name itself, we can understand the laser beam is delivered transurethrally through a fiber instrument for cutting, coagulation, and vaporization of prostatic tissue. There are variety of laser procedures using different sources, wavelengths, and delivery systems. So basically, the laser beam is being used to remove the prostate tissue and through a fiber instrument, and it will be useful for cutting, coagulation, and vaporization of the prostatic tissue. Now, the another method is photovaporization, PVP. It will be using high power green laser light to vaporize the prostate tissue. The same thing above described. Improvement in urine flow and symptoms are almost immediate after the procedure. So through photovaporization, the prostate tissue is being vaporized by using high power green laser light. The last one in minimally invasive therapy, that is interstitial laser coagulation, ILC. So here the prostate is viewed through a cystoscope. So the direct visualization of the prostate is being done through cystoscope, and a laser is used to quickly to treat the precise area of the enlarged prostate by placement of interstitial light guided directly into the prostate tissue. So here it is comparatively more precise, and the precise areas of the enlarged prostate by placement of interstitial light. So here we are using interstitial light, and that will guide to the precise area of the prostate gland where we have to reduce the size, and it will be uh, done under the visualization, that is through cystoscope. Now, one more thing, that is intraprostatic urethral stent. This is just stent in order to dilate or to have the maximum relief of obstruction. That is, the stents are placed directly into the prostate tissue. The complications are mainly chronic pain, infection, and encrustation. Okay. So the stents will be placed directly into the prostate tissue so that the compressed area will be dilated and the normal urine flow can be achieved. But in case of this, some of the complications may happen because of the presence of this stent, such as chronic pain, infection, and encrustation. Okay, so the encrustation means nothing but the crustation over the crust formations. Crusts will be formed over this stent. That is nothing but encrustation. Now we are having invasive therapy. So minimally invasive we have already seen. Now we are having invasive therapy. That means surgery. There are a lot of surgeries are being done, and it is the most symptomatic PPH cases are using these surgeries. And the choice of treatment, which type of surgery, that is purely depends upon the size and location of the prostatic enlargement, and also some of the patient factors like age, surgical risk, etc. So basically, we are having mainly two approaches, that is transurethral resection of the prostate, TURP. So here, transurethral resection of the prostate is a surgical procedure involving removal of the prostate tissue using resectoscope inserted through the urethra under general or spinal anesthesia. So under general or spinal anesthesia, by using a scope, that is resectoscope is being used, and there we will be inserting this resectoscope through the urethra, and we will be removing the prostate gland. Okay, that is transurethral resection of prostate, and it is a gold standard for surgical treatment of obstructing BPH. So this is a gold standard treatment for BPH. This is the picture. We will be using a resectoscope, and we will be inserting through the urethra, and then we will be destroying, or the removal of the prostate gland is being achieved. Now, transurethral incision of the prostate. So here, TUIP. This is a surgical procedure done under local anesthesia for men with a moderate to severe symptom. So it is under local anesthesia when comparing with the previous one. Several small incisions are made into the prostate gland to expand the urethra, which relieve the pressure on the urethra and improve the urine flow. So here we are just making some of the incisions, or common language we can call this holes. Several holes or several small incisions will be made into this prostate gland, and we will be able to expand the urethra. Thereby, we can relieve the symptoms. So here nothing is being removed. The prostate is not being removed, but small incisions are being made upon it. Okay, that is TUI. Okay, so the complications. So the basically after BPH, if the BPH is not being treated properly, the patients will be developed with the complications such as hydronephrosis, hydroureter, gross hematuria, UTI, acute urinary retention. Okay, gross hematuria means more blood in urine, which is uncontrollable, and a large amount of RBCs can be found out in urine. Okay. So these are the complications of BPH, that is hydronephrosis, hydroureter, gross hematuria, UTI, and acute urinary retention. Hydronephrosis, nothing but fluid in kidney. Hydroureter means fluid backup in the ureter because obstruction is there, urine is not able to being passed. So hydroureter as well as hydronephrosis will be happening. Okay. Now coming to nursing diagnosis and the nursing management. So these all are the some nursing diagnosis that we can apply. That is impaired urinary elimination, acute pain, risk for infection, risk for fluid volume deficit, potential for sexual dysfunction. Okay, so this is only two-part nursing diagnosis is being given here. You have to make a note with while writing the notes. You should more focus on this nursing. That is three-part nursing diagnosis should be there in your notebooks. Okay, this is just a clue for writing up the care plan for BPH. Okay. Now, here we have highlighted some of the management part, that is preoperative care. What is the preoperative care as well as the postoperative care? So in preoperative care, it's very easy. So we have to inform about the procedures, what is being going to done, and what are the postoperative days, how will be it, etc. have to be informed. Also, the complications of surgery should be discussed. Then antibiotic administration before the procedure. Then bowel preparation that we all know that should be done before night. Then optimal cardiac respiratory, that is PAC anesthesia checkup that have to be done, and the fitness should be the cardiac respiratory everything status, that is, status must be mentioned, and ensure we should ensure the fitness. Okay. Then restoring urine drainage and encouraging the high fluid intake are also helpful in managing the infection. So we have to encourage the patient to increase the fluid intake. Okay. Some of the postoperative care aspects like catheter system patency have to be maintained, and signs of water after TURP, that is nothing but IO chart that have to be maintained. Then instruct the patient not to try to void around the catheter. Explain feeling of needing to void from pressure of catheter that have to be instructed. Avoid use of enemas, rectal thermometers that must be avoided after the procedure. Medications, especially analgesics, must be given to the patient. Dressing should be changed frequently. Then we should give the opportunity to ventilate the feelings of the patient. Then fluid and voiding must be increased. Exercise, a vigorous exercise should be avoided, and straining during defecation that must be avoided. Then must enforce the client or advised to take high fiber diet to have smoothen the stool passage. Then driving for 2 weeks must be avoided. So these all are the nursing management part that have to be focused in patients with the diagnosis of benign prostatic hyperplasia. Okay, so hereby we have completed the nursing care aspects. So from the definition, etiology, risk factors, pathophysiology, clinical features, diagnostic measures, everything we have seen. Management, mainly surgical, several categories we have seen. Hope you have got some idea regarding this BPH. Any doubts you can ask me and have the notes properly. Okay, thank you.